All right, welcome to part two. I don't have any little puppet here. Okay, there we go. There's our little puppet again. Let's continue. All right, let's talk about the thyroid gland, and that's part of your discussion this week. The thyroid gland makes two different hormones, the thyroid hormone and calcitonin. Um, we don't really see problems with calcitonin, but we sure do see a lot of problems with this guy. So the thyroid hormone, think of it as the gas pedal. It regulates the metabolic rate of every cell in your body. It's going to control the rate at which they burn nutrients. It allows you to generate heat. It affects metabolism of proteins. It's necessary for normal growth and development. All of that from this gland that's found right here, this sort of butterfly-shaped gland that you have somewhere right in there. Um, and there are all sorts of problems we see. Right, here's a little cat that is hyperthyroid, and if you could talk to the owner would tell you that the cat is probably yowling all night, and oops, sorry. The owner would probably tell you that the cat is making noise all night and is eating, has a great appetite, but keeps losing weight and is drinking a lot and peeing a lot. And the reason is this cat is making too much of the thyroid hormone. And in fact, if you could feel this cat right here, you would probably feel a little tiny bump. That would be this little tumor on his thyroid gland. We call that a thyroid slip. If you have a cat, just take your fingers and just run them right down here. Do that for every cat you can find. Most of the time, you won't feel anything. But then there will be a cat who's hyperthyroid, and then you'll feel it might just be the size of a sesame seed, but then you'll feel this little sesame seed fly by your fingers, and that will help us realize that this cat is hyperthyroid. That's mostly cats. Dogs almost never get hyperthyroidism. Dogs get the opposite problem where they're not making enough thyroid hormone. So now if his foot is too far on the gas pedal, the dog's foot is not on the gas pedal enough. And so these dogs, their metabolic rate is slower. They just have sort of vague signs. Mentally, they're kind of dull. They'll lose hair, alopecia, in other words, but they're usually not itchy. They'll lose hair bilaterally along their sides or along their back. They don't want to. They tire out really easily, what we call exercise intolerance. And very important is they gain weight, but they don't have a great appetite. What I mean is, if an owner brings you a dog that's overweight and this dog has an amazing appetite, and the owner says, I want to test him for hypothyroidism, I would probably try to talk the owner out of that because that dog is probably just fat. The hypothyroid dog, his appetite is not great, but he keeps gaining weight. And then finally, there's this condition. It's not a thyroid problem, but it's called sick euthyroid syndrome. We call it syndrome when we don't really understand something. Like you've heard the term chronic fatigue syndrome. Syndrome is a word we use when we don't totally understand something. So the sick euthyroid syndrome happens when the thyroid gland is totally fine. EU means good or true, like euphoria or euthanasia, right? Euthanasia means good death. So euthyroid means you have a good thyroid, but if we test the thyroid hormone levels, they'll be low. We'll have low thyroid hormones, even though the thyroid gland is fine. And we'll talk more about this in discussion this week. This is part of why thyroid, hypothyroid conditions are, let me start over. This is why hypothyroidism is difficult to diagnose. It's easy to treat, but difficult to diagnose. There is not just one thyroid hormone, not exactly. And I just wanted to show you this. At your internship sites or workplaces, get in the habit of looking at blood work. On a lot of blood panels, you'll see this, total T4. You won't usually see free T4, but we'll talk about that in a minute. Total T4 is very common on different blood panels. And let's explain what that means. The thyroid gland is actually making two thyroid hormones. One's called T3. It has 3 iodine molecules. The other one is called T4, and that has 4 iodine molecules. And iodine, by the way, is essential to the formation of thyroid hormone. That's why your salt, table salt, contains iodine. It contains iodine so that you don't need it, so you have enough iodine for your thyroid gland to produce thyroid hormone. That's why iodine is added to table salt. T3 is the active form. That's the form that controls your metabolism. But the thyroid gland actually makes very little T3. What the thyroid gland makes is T4. Most of that is bound to big proteins, maybe something like albumin, and it can't leave the circulatory system. It cannot leave the intravascular space. Only a tiny amount is actually unbound. Only a tiny amount is free to leave your circulatory system, where it is converted to T3 by the liver, and the kidney, and muscle as needed, right? And T3, remember, that's the biologically active form of the thyroid hormone. There's not a lot in your body. What there is a lot of is total T4. And so when you see that on a blood test, it's measuring both the protein bound and the free T4. That's sort of the reservoir. Oh, okay, thank you. That's sort of the reservoir to make the biologically active T3. It's the raw material to make T3. Sometimes it's more accurate to measure only the free T4 and not the free T4 and the protein bound T4. But to test only for the free T4 is much more expensive. A total T4 test may only cost, a few dollars as part of a blood panel. An $80 blood panel will include total T4. The free T4 test by itself may be $120. But for difficult to diagnose cases, free T4 can help. And sometimes we need to measure T3 and even the thyroid stimulating hormone levels. Sometimes measuring all of those together can help us say, oh, you know what? This dog is not really hypothyroid. His free T4 levels are fine. His T3 levels are fine. There's something else wrong. It's not his thyroid gland. But if he has low free T4, he has low T3, things like that, then we can say, oh, okay, great. He really is hypothyroid. And remember, we talked about the example of the thermostat later. So let's apply that to the thyroid gland. What happens is, as T4 levels start to build up, so there's the thyroid gland making these thyroid hormones. So T4 levels start to build up. That's like the house heating up. That information feeds back to the anterior pituitary gland and has a negative effect. It tells the anterior pituitary gland to produce less thyroid stimulating hormone. T4 also feeds back to the hypothalamus and tells it to produce less TRH, but we don't care about TRH. That's called thyroid releasing hormone. This is an example of negative feedback. Now let's talk about the other hormone that the thyroid gland makes, and it involves calcium. Now, you may remember calcium is pretty important. It is important for clotting factors. In hemostasis, you must have calcium for clotting factors to work to clot your blood, to help convert fibrinogen into fibrin. Calcium is important in how muscle fibers contract, and calcium is important where one neuron meets another neuron in the release of neurotransmitters. So calcium is really important in clotting, nervous system function, and muscle system function. And so that's where calcitonin comes in. It's one of the two hormones responsible for controlling your calcium levels so they don't get too high or too low. Now, I find it a little annoying that calcitonin, by its name, I would think that it would increase levels of calcium, but no, that's not what it does. Calcium causes calcitonin causes calcium levels to decrease. So when the body has enough calcium or too much calcium, calcitonin will tell the intestines to not absorb calcium. It will tell the kidneys, don't reabsorb calcium, just excrete it in urine, and it'll actually help put calcium into bones. The other hormone involved with calcium are found in the parathyroid gland. So these are kind of like chocolate chips in a chocolate chip cookie, the cookie being the thyroid gland. There are these other little glands scattered throughout called parathyroid glands, and they make parathyroid hormone. And its job is to increase calcium levels. So if your calcium levels are low, parathyroid hormone gets released, and it causes osteoclasts to munch up bone and release calcium. It tells the urine to reabsorb more calcium. It increases the absorption of calcium from the intestines. Actually, vitamin D gets involved here too. And we do see some problems. It's not really the fault of parathyroid hormone, it's more the fault of iceberg lettuce. So this could happen in any animal, but we see it mostly in reptiles that are fed greens that are low in calcium. If you feed this iguana, I think that's an iguana, I don't know, or this turtle diet that's too low in calcium, then parathyroid hormone levels have to increase so that these reptiles have enough calcium. And what happens is, where do they get the calcium from? From their bones, from their shells. And so they end up with these kind of weird, soft bones, or these kind of weird, misshapen shells, because the parathyroid hormone is needing to take calcium from the bones and from the shells so that the blood levels have enough calcium. Another very important gland, of course, is the adrenal gland, found on top of the renal. That's why it's called adrenal. It's on top of the kidney, and it's actually two glands in one. So like the pituitary gland, these are two completely different glands that somehow have ended up together. And we call one of these glands, we can refer to it as the cortex, or the outer part of the gland. It's better just to call it the adrenal cortex, and it makes the hormones in these two big categories: glucocorticoids and mineralocorticoids. The main glucocorticoid is called cortisone, and the main mineralocorticoid is aldosterone. There might be others. I've never heard of them before. I've only heard of this too. And remember, the pituitary hormone ACTH stimulates the adrenal gland to release its hormones. So what does cortisol do, or cortisone? They're essentially the same thing. So cortisone, we talked about in pharmacology. It's a stress hormone. If you are either in some sort of an acute or chronic stressful situation, its job is to help increase your blood sugar levels. Now that's important. For example, let's say you are having to walk 100 miles because you're lost in the wilderness. Well, you're going to want plenty of blood glucose. If you're being, chased, for hours at a time, or you're in combat or something, you want a steady supply of blood glucose. Well, cortisone will help you with that. It causes breakdown of proteins and lipids, which can be converted to glucose in the liver. It also helps the body resist certain effects of stress. That's why it's a great anti-inflammatory. But its main job is to increase blood sugar in kind of a slow way. And then the other hormone, the mineralocorticoids, and the only hormone I've ever heard of is aldosterone. It's named for its effect on minerals, in this case, sodium and potassium. Aldosterone, you may remember, it targets the kidneys, and it, along with anti-diuretic hormone, they work together to reabsorb water, to take water out of the kidney and put it back into the circulatory system. The difference with aldosterone is it causes the reabsorption of sodium, and then water will follow sodium. And when the kidney reabsorbs sodium, it has to exchange that by putting a potassium into the nephron. So they tend to help us get rid of potassium, hold on to sodium, and that's really important because it helps us to increase blood pressure. And aldosterone is part of that RAA system you've seen in pharmacology, the renin angiotensin aldosterone system. That's the outer part of the adrenal gland. That's the cortex. Now let's talk about the medulla. So the adrenal medulla makes epinephrine and norepinephrine. Now, yes, that's the same norepinephrine. That's the neurotransmitter. I guess it can work as both a neurotransmitter as well as a hormone. So I'm going to show you a video clip. It's going to show how a stressful event causes the release of both cortisol as well as these catecholamines, epinephrine and norepinephrine. Now, aldosterone would also be released, but it's just not shown in the video. And the video is also going to mention CRF, and that's a hormone from the hypothalamus that we don't care about. But I think it's a useful video. The video suggests that ACTH would cause the release of epinephrine and norepinephrine. And ignore what I wrote on the screen here. I guess ACTH would do that, but please also think about your sympathetic nervous system, that there's an actual nerve going to the adrenal gland, causing the release of epinephrine and norepinephrine. That would be an example of that car wreck I told you about, where you still feel that adrenaline rush even an hour later. Adrenaline is the old term for epinephrine. So this person could have been hit by another car, or maybe they just rode a roller coaster, or we don't know. But there's the hypothalamus, and then there's the anterior and the posterior pituitary glands. So we don't really care about the posterior. We're just going to watch what happens here. So there's this stressful event, and who cares about CRF? And now a little hormone known as ACTH gets released, and it's going to make its way to the adrenal glands. But also just imagine there's actual nerves that are stimulating the adrenal gland. So, and then cortisol and aldosterone would get released, and so would epinephrine and norepinephrine. All of this to help you deal with stress. That's right, hyper alertness. Well, as you can guess, there are some disorders that we see here. Again, let me just look at my notes real quick. That's right, okay. So this little dog and little Sebastian, they have a condition where there is too much cortisol, and that condition is called hyperadrenocorticism, named also known as Cushing's disease. And what's useful to think about is cortisone is one of those hormones that affects muscle cells and skin cells and the immune system. It affects so many different parts of the body. So that's why patients with endocrine disorders and with cortisol disorders in particular, we see lots and lots of other systems acting abnormal. So this dog has hair loss. He's got this muscle, he gets loss of muscle in his belly, so his belly gets really big. The cortisol affects ADH the same way that caffeine and alcohol does. So he drinks a lot and pees a lot. Maybe it's a she, I can't tell. Um, um, Wounds wouldn't heal very fast. Those are things we might see in this dog. And we would see the same things in the horse for unknown reasons, unknown to me. Horses don't lose hair. Instead, their hair grows without falling out, and we get this weird shaggy appearance. Um, in dogs, this condition develops because the dog gets a tumor on the adrenal gland that is making excess cortisone. Or sometimes they have a tumor on their pituitary gland and they're making excess ACTH, which in turn tells the adrenal gland to make too much cortisone. I apologize if I'm using the words cortisol and cortisone interchangeably. It's okay, they are interchangeable, but I should try to stick to one word. Now, remember we mentioned negative feedback. We use negative feedback to diagnose hyperadrenocorticism. There's a test. If a dog comes in, maybe he or she does not look like this dog, but still the veterinarian suspects the dog has hyperadrenocorticism. The way we diagnose it is this test, the low dose dexamethasone suppression test. Do you remember what dexamethasone is? That's a glucocorticoid. That's a drug that's based on cortisone. So here's how this test works. The dog comes in the morning and we take a blood sample and then we give an injection of dexamethasone. It's a very, very small amount. 4 hours and 8 hours later, we take blood samples. So at 4 hours after that dexamethasone injection, we get a blood sample. And then in another 4 hours, we get another blood sample. In a normal patient, that dexamethasone should suppress the production of cortisol. So a normal dog, that morning sample might have this much cortisone or cortisol, but then at 4 hours, it's going to be really low, and at 8 hours, it's going to be really low because the dexamethasone has had a negative feedback effect, okay? In a dog with a tumor that's making cortisol, the tumor does not care. The tumor is not going to respond to negative feedback. And so in this dog, we take that morning sample, he'll actually have very, very high cortisone levels. We give the dexamethasone, and guess what? It doesn't come down at all. There is no negative feedback, or maybe there's very little negative feedback. And then 4 hours later, when we take our next sample, it's probably back up where it started. So again, we use this concept of negative feedback to understand and design tests like the low dose dexamethasone suppression test. This disease is a very frustrating disease. This is the opposite problem called hypoadrenocorticism or Addison's disease. President John F. Kennedy had it. It's a very common disease in standard poodles, and it's frustrating because it can look like a lot of other diseases. I've known many veterinarians who were fooled by Addison's disease. They thought a dog had hepatitis. They did not have hepatitis. They had this disease. Another dog they thought had kidney failure. The dog did not have kidney failure. The dog had Addison's disease. It's because these dogs are both low in cortisol and aldosterone. And so the signs can be kind of vague. They can be vomiting, weakness, loss of appetite. Their kidney values can go up. It can affect the liver for some reason. If you're lucky, these dogs have really, really high potassium levels and really, really low sodium levels, and they're a standard poodle. So you can usually deduce that it's Addison's. But sometimes the potassium levels and the sodium levels are totally normal. And so you have to do a different test. I don't have a slide for it, but the way we would diagnose hypoadrenocorticism is we give the dog that hormone called ACTH. If we give a dog, a normal dog, ACTH injection, that dog should make a lot of aldosterone. Dogs with this disease, we give them ACTH, they don't make any aldosterone. They don't make any cortisone. So, and that's called the ACTH stimulation test. How do we treat this disease? We give the dog mineralocorticoids and glucocorticoids. And you'll learn more about those medications in pharmacology in a few weeks. Next up, the pancreas. The pancreas makes insulin, which is a very well-known hormone. It makes glucagon, which is not so well-known and frankly, not so important. So we really want to make sure we understand insulin. And we'll learn more about the insulin medications in pharmacology too. But let's make sure we understand what the pancreas does. The pancreas is actually two organs in one. It's an exocrine gland and an endocrine gland. By exocrine gland, I mean that it produces digestive juices that it squirts into your small intestine. And we'll learn more about that in a few weeks when we study the digestive system. It also makes the hormone known as insulin, and that gets secreted into the bloodstream. Insulin's job is to lower blood sugar. It lowers blood sugar by moving, allowing blood sugar to move inside of cells. So here you can see pancreas, and these big yellow dots are insulin, and now insulin will allow these little sugar cubes to enter these cells here. A very common disorder we see is called diabetes mellitus, and it's either caused by a deficiency of insulin or there are receptors that are not responding to insulin, receptors on the cells. And we call the first type type 1 and the second type type 2. How the clinical signs are these patients are usually drinking a lot, they're peeing a lot, they're losing weight, they can develop cataracts, there's other things that they can develop. And we treat them with insulin. A common misconception is people will think that diabetes causes hypoglycemia. That's not, diabetes causes hyperglycemia. It's the treatment that can cause hypoglycemia. So if a diabetic is feeling lightheaded and they need to eat a chocolate bar, it's the insulin treatment that's doing that. It's not diabetes that's doing that. How do we diagnose it? It's pretty easy. If a patient has high blood sugar and sugar in their pee, it's probably diabetes, especially if there's a history of weight loss and polyuria, polydipsia, things like that. Now, we learned last semester how stress can cause hyperglycemia too. A dog or a cat comes in, the owner says he's drinking and peeing a lot and losing weight. You get a blood sample and a urine sample and there's sugar. Well, it might not be diabetes, but there's a pretty easy test you can do called the fructosamine test that, gosh, I thought we talked about last semester. The blood sugar test, the blood glucose test, we could run it on you right now, and it tells you what your blood sugar is right now. People who are diabetic, they run that test on themselves. They prick their finger, and they have a little glucometer, and they measure their own blood glucose. This test, fructosamine, is really cool. It tells you your average blood sugar over the last 2 weeks. And so if a dog or cat comes in and I think, boy, I'm not sure this is really diabetes, I can run the fructosamine test. And so if they have a high blood glucose reading, but a normal fructosamine, it's not diabetes. If their fructosamine is normal, that they were probably stressed. If they have diabetes mellitus, the fructosamine will also be really high. We don't really care about glucagon. It's the other hormone, but you need to know what it is. Its job, just like parathyroid hormone's job is to increase calcium and calcitonin's job is to decrease calcium, glucagon's job is to its job is to increase blood glucose, where insulin's job is to lower blood glucose. So glucagon probably also helps with stressful events. It acts on the liver. It gets released if your blood sugar really does get low, and it's going to stimulate the release of glucose from the liver. Remember, the liver stores things like glucose in the form of glycogen, and glucagon can also stimulate the creation of glucose from proteins and fats, and that's called gluconeogenesis. Gluco means glucose, neo means new, and genesis means creation. So it's the creation of new glucose. That's exactly what glucocorticoids do as well. They also cause gluconeogenesis. And because there are other hormones that do that, if you had a deficiency of glucagon, it would not be so devastating because there are other hormones that can do the same thing. Not so with insulin. Insulin is the only hormone that can decrease blood glucose levels. Now, this is not in the book, but remember we mentioned this earlier. Let me look at my notes real quick here. Right. So we asked earlier, what causes gestational diabetes? Why don't you want to stress out an animal in labor? Why don't you want to stress out an animal trying to lactate? Well, the reason is that steroid hormones can antagonize the effects of the peptide hormones, oxytocin and insulin. So, for example, cortisone from stress, or cortisone being used to treat an allergic dermatitis, or cortisone from hyperadrenocorticism. All of those can interfere with oxytocin and insulin. Also, the steroid hormone progesterone, that's the hormone that helps maintain pregnancy. It can also antagonize, in this case, it antagonizes just insulin. And here's what I mean. When I say antagonize, let me show you what I mean. So remember we said some hormones are steroids, like progesterone and cortisone. They are lipophilic, so they can pass. Here it is. There's progesterone or cortisone. They can pass right through the cell membrane into a target cell. Other hormones, like the peptides, some of them cannot enter cells. So insulin and oxytocin, they work on the outside of the cells where these receptors are. They are not lipophilic. They cannot go inside the cell. Okay, for reasons that are way too complicated for anybody to understand, here's what happens. The steroid hormones, here they are, right? This could be, let's say this is cortisone. It will sort of block or antagonize the effects of oxytocin or insulin, right? This little green dot would be oxytocin or insulin. And now this weird effect where the steroid hormone is blocking their effects. So that's why you don't want, if you're a lactating mammal, you don't like stress. Stress will interfere with the action of oxytocin. In other words, cortisone will not allow oxytocin to work on receptors. So if you ever go to work or ever visit a dairy, you'll notice that where they milk the cows should be a calm and quiet place. The other example is this is why gestational diabetes develops. If you're pregnant, you have high levels of progesterone. It can interfere with the action of insulin, and that's the hormone that helps lower glucose by moving it into cells. In other words, progesterone will not allow insulin to work. And so blood sugar levels will go up, and cells will be starving for glucose. And finally, cortisone can also interfere with insulin. Cortisone can interfere with oxytocin, and it can interfere with insulin. So this horse or that dog that has hyperadrenocorticism, they are at risk for developing diabetes. They're at risk for their blood sugar levels to go up and up and up. And not just hyperadrenocorticism, but if we give drugs like prednisone long term, we can cause diabetes as well. Okay, so that's it. That's it. Those are the endocrine glands and their hormones. And in a couple of weeks in pharmacology, we'll get a chance to look at how we treat these diseases. You'll see all of this again, so you'll have another chance to learn about them. Let's talk about a few other hormones and a few other hormone-like products or hormone-like chemicals. So you may remember from last semester, the kidney makes a hormone called erythropoietin, and it works on bone marrow to produce red blood cells. We also said how the kidney makes this hormone called renin that helps lead to increased blood pressure. I'm going to confess, I do not find these next couple of hormone-like substances very important. I have never seen any diseases that are caused by excessive or deficiencies in these chemicals, but it's in the book, so I gotta mention it. So your stomach makes this hormone-like substance called gastrin, and that's what I'm trying to show you here, this green arrow. It's kind of funny. The stomach makes gastrin, and the target is the stomach. So the stomach is telling itself something. When the stomach makes gastrin, it's like it's talking to itself and telling itself to make more hydrochloric acid and more digestive enzymes, and for the muscles to kind of contract to help mix up that breakfast burrito you ate. So that's gastrin. And then your small intestine also makes a couple of hormone-like substances. Again, they're acting on themselves, and they're also acting on the pancreas. This little pink cloud here is supposed to be the pancreas. So the small intestine makes this chemical called secretin. It does this when chyme is just the partially digested breakfast burrito. When chyme enters from the stomach into the first part of the small intestine, secretin is released, and that's going to stimulate the pancreas. It stimulates the pancreas to release bicarbonate to help neutralize the chyme, which is acidic. Not Kimby, but chyme. Well, the subtitles do not recognize the word chyme. The other chemical that gets released is called cholecystokinin. It's abbreviated CCK, and again, when that breakfast burrito enters the small intestine, cholecystokinin will stimulate the pancreas to release digestive enzymes. And that's what this blue arrow is supposed to represent. When a female is pregnant, her placenta actually makes a hormone. A hormone is called chorionic gonadotropin. There's that word tropin again. Again, it's going to have some stimulatory effect. And in this case, it's going to maintain or support or promote pregnancy. It's important for allowing the pregnancy to continue. So the fertilized egg helps make this hormone and will maintain pregnancy. I don't know, here's this little elephant fetus. I don't know if that's real or not, but anyway, in fact, pregnancy tests, that's what they are testing for. They're testing for the presence of human chorionic gonadotropin. But if the female does not get pregnant, then the fertilized egg never makes chorionic gonadotropin, and then the uterus will produce this prostaglandin that you'll learn more about in the next few weeks, and that will destroy the corpus luteum, and then the cycle can begin all over again. But the point here is that there is this little hormone made by the placenta. Well, I guess it says, that's strange. I wrote it's placental, but it's really the fertilized egg that makes it. So it's not that important. The thymus is both part of the immune system by being part of the endocrine system. So the thymus gland makes some sort of a hormone. We don't care about the name, but it helps educate those lymphocytes into T lymphocytes. You may recall you've got B lymphocytes and T lymphocytes, and the thymus gland, when lymphocytes travel through the thymus gland, that's where they get educated to be able to act as helper T cells or killer T cells to help recognize things like the coronavirus and other viruses and cancer cells and things like that. Have you ever wondered what controls your sleep cycle? Well, you've got this weird little part of your brain called the pineal gland, and it makes this little chemical called melatonin. And melatonin levels go up and down. You may have heard you shouldn't look at your cell phone in bed at 1 a.m. because it will screw up your melatonin levels. It influences your sleep cycles. And we will actually prescribe melatonin for certain patients that have disturbances in their sleep cycles. Usually it's older dogs and cats that have some sort of cognitive disorder. And finally, our old friend, prostaglandins. You've heard us talk about the good prostaglandins and the bad prostaglandins in pharmacology. Well, of course, we're mostly talking about the good prostaglandins because they work locally to have certain protective effects. They can increase blood flow to that part of the nephron called the glomerulus that helps protect the kidney. They can increase production of stomach mucus, and that protects the stomach. But of course, there are other prostaglandins that cause inflammation. We call them bad. They're not totally bad, right? Inflammation is not always bad. It's just bad if it's going on day after day after day, or if it was caused from some injury and it's causing more harm than good. And we can try to inhibit their production with the drug family known as non-steroidal anti-inflammatories, and we can also try to inhibit them with the glucocorticoids. As we've discussed in pharmacology, though, of course, the danger is when you try to inhibit the bad prostaglandins, you may end up inhibiting production of the good prostaglandins, and that can decrease blood flow to the kidneys. It can decrease production of stomach mucus, so it can have some detrimental side effects. I think I mentioned this. I'll give you all your own little copy of the scratcher if you're in class tomorrow, and you can check your answers. Certainly, if for some reason you're not, if you lose your scratcher, or if you have a question, maybe I marked something wrong, just email me, and we'll go from there. All right, everyone. Thanks for joining me, and I will hopefully see you. If you're passing through on Thursdays, please write me any questions, call me, and I'll see you on the discussion board as well. All right. Thank you. All right. Bye-bye.